as good as it is on the day you're using it. Otherwise, I'm using patients as an experiment.
Yeah, so some of the key benefits that we have from the system really are that, one, robotics are extremely accurate. So unlike the old style instruments that we use, which are accurate within plus or minus 3 degrees, the robot is sub-millimeter accurate, sub-degree accurate. And the other thing is that historically, we've given all patients straight legs, but with the advent of the robot, we're able to replicate that natural alignment and that natural soft tissue envelope from the patient.
I mean, certainly it looks like a fun tool to use, and it probably definitely will be the future. My great issue with it, Sam, is are we there yet? I mean, you definitely have the best robot. You're probably the most advanced one, and I've been waiting for it. Okay, and this is why it's worth the wait. But is it there? Yeah, it's not completely autonomous, and I think patients need to understand that.
Yeah, I think that's it's a really important point, and I think we deliberately don't have a completely autonomous robot. You're the surgeon, you're the expert. We want you to be in control of the robot. So whilst the robot guides you where to make those resections, you're responsible for the plan, and you're responsible for how you make those resections. And actually, in terms of the patient feedback, patients are much happier. We see that in all of our kind of registries, our national joint registries, that patients are much happier when they've had a robotic procedure.
Again, I've been fairly take issue with a little bit of that, but that's fine. And I think you can't be kind of completely Philistine and say, right, we're going to be ignoring it. But this is not there yet. We're in the Tesla phase. Tesla's not driving us around yet, but it will get there. And this is why I think surgeons do need to embrace it. But I think there is a tendency as well to experiment a little bit with patients. Maybe the operations are taking longer, despite what people say. You come to this conference, they're taking exactly the same time. Ask the nurses in theatre. They're rolling their eyes. Another hour, 2 hours just to do one procedure. Yeah. That has implications for infection as well.
Yeah.
Okay? So I don't want to be jumping into a robot and causing patients potentially harm just because it makes me want to play with toys. I've got to get it absolutely right that this is the way ahead to that individual patient.
Absolutely. And look, this is the latest, greatest technology. As you say, it's new to the market. It's coming to the Middle East. We do have good data. We've done over 100,000 procedures with the VELYS robot now globally. We talk about intraoperative time in the time it takes to do a procedure. There is definitely a learning curve with these things, but ultimately you will be able to get down to a kind of time neutrality.
Yeah, and I think that's the point about the learning curve. There's lots of learning curves, and why would I subject my individual patient, not the hundreds that I will eventually do it on, to that learning curve? Okay, and that's the issue I've got with it. The learning curve has to be immediate, otherwise no point.
Yeah.
Something has to be as good as it is on the day you're using it. Otherwise, I'm using patients as an experiment.